We usually treat time in the outdoors as a poetic escape, a weekend luxury for when we want to clear our heads, totally separate from the serious, data-driven world of modern medicine. But in 1984, an architectural researcher named Roger Ulrich started looking at patient recovery records at a suburban Pennsylvania hospital and found something that forced the medical community to pay attention. Ulrich looked at patients recovering from gallbladder surgery in identical rooms. The only difference was the window. Half the patients stared out at a brick wall. The other half had a clear view of a small stand of deciduous trees. The patients looking at the trees healed faster. They were discharged nearly a full day sooner, and nurses' records showed they required significantly fewer heavy opioid painkillers to manage their recovery. The outdoors acts on the human body as a specific, measurable medical intervention. It is a biological tool, and like any drug, to get the desired effect, we need to know the exact dosage. University of Michigan ecologist Mary Carol Hunter spent years trying to pin down exactly what that dosage is. She wanted to find the minimum effective dose of nature required to physically alter our biology. She ran a study where city residents spent time in any green space they wanted. The rules were strict but simple. They had to be completely unplugged from their phones, and they couldn't do any aerobic exercise. They just had to sit or stroll. This chart illustrates the chemical result. Through the day, our body's stress hormone, cortisol, naturally declines at a gentle slope. But for the people spending time in green spaces, their cortisol dropped 21.3% faster per hour than that normal daily decline. By tracking their saliva, Hunter pinpointed the window of peak efficiency. The absolute steepest drop in stress hormones happens exactly between 20 and 30 minutes of exposure, before the benefits start to level off. 20 minutes is the scientifically established minimum daily requirement to biologically halt chronic stress. That solves the daily stress equation, but researchers also wanted to know how this scales up over time. For that, we look to an epidemiological study led by Matthew White at the University of Exeter. White's team tracked the recreational habits and health outcomes of nearly 20,000 individuals across England to see if there was a cumulative tipping point for their well-being. This threshold chart shows a surprisingly rigid boundary. Below 120 minutes of nature contact a week, there is essentially zero measured health benefit. The moment a person's cumulative exposure hits 2 hours, they show a 59% higher likelihood of reporting good health. The data also show it doesn't matter how you accumulate that time. You can knock out those 2 hours during a long weekend hike, or break it up into short daily bursts in a local park. 120 minutes is the weekly threshold to move from managing immediate stress to significantly increasing the odds of maintaining high long-term well-being. To understand exactly how this dosage changes our mental state, we have to look at the brain's physical activity. At Stanford University, researcher Gregory Bratman ran an fMRI study to track blood flow during a walk. He split healthy adults into 2 groups. Half of them spent 90 minutes walking alongside a high-traffic, concrete urban road. The other half spent the same amount of time walking through a quiet, green corridor lined with oak trees and open hills. When they scanned everyone afterward, the nature walkers showed decreased blood flow to the brain's subgenual prefrontal cortex. That is the specific region of the brain responsible for repetitive rumination and risks for depression. The urban walkers showed no change at all. The nature walk provided the first evidence of a neural mechanism that quiets the regions of the brain associated with chronic anxiety. Down at the microscopic level, the effects are even more aggressive. In Tokyo, a physician named Dr. Ching Li started sending businessmen out on 3-day forest trips to study their immunology. He wanted to test the effects of phytocytes. These are volatile airborne chemicals that trees emit into the air to protect themselves from insects and rot. When humans inhale these specific compounds, our biology reacts. Blood tests from the forest walkers revealed a massive 50% spike in the activity of natural killer cells. The specific white blood cells our immune system uses to hunt down tumors and viruses. This chemical upgrade is highly durable. Follow-up tests showed that after a single weekend in a dense forest, those immune levels remained elevated for up to 30 straight days. Breathing forest air triggers a direct chemical transaction that physically armors your immune system against disease. While this intervention is potent, the clinical literature is very clear that the human body won't absorb it if you make one major mistake. Bringing modern technology, specifically staring at a smartphone, completely negates the cognitive benefits of the walk. Researchers have tracked exactly what happens when people use their phones in the park. It induces a stooped posture, measurably worsens their mood, and prevents the attention restoration that the brain needs to reset. This means the treatment is fragile. It requires complete physiological and digital disengagement to actually be metabolically absorbed. To get these intense medical benefits, you might assume you have to pack up heavy gear and travel into harsh, remote wilderness. You don't. A simple, everyday city park with grass and trees is fully sufficient to trigger the neurological cooldown and lower your cortisol. The peer-reviewed protocol is straightforward. You need 20 minutes a day, adding up to 120 minutes a week, completely phone-free. And when you can, get out to real, dense forests to breathe in the airborne phytocides that directly activate your immune system's cellular response. Spending time in nature isn't an escape from the real world. It's a return to the environmental conditions our biology was designed to function in.